muscles, you have a nice kind of cool naming convention, okay? You have 6 muscles, and they have prefixes and suffixes, which is great, okay? So the prefixes, you have 3 prefixes, and the prefixes are related to, like, how high we're talking on the cat's back, okay? The highest have the prefix clavo, like your clavicle, which is really high in your chest, right? The next set have the prefix acromio, like the acromion process on your shoulder, right, on your shoulder blade. And then you have the spinos, which are like near your spine. Those are the lowest. Then you have the suffixes, and they refer to if it's more medial or more lateral, okay? The ones that are more medial have trapezius as the suffix. The ones that are more lateral have deltoid as the suffix, okay? So on the top of his shoulder here, kind of coming from his neck, you have this muscle right here. And, I mean, if you look at the top of his shoulder, it may be hard to show some people, but there's a little line right here, and that's where it ends. So it goes from here to here. This guy right here is the clavotrapezius. And then forming the top of his shoulder right here, well, it may not go that far, but forming the bump on the top of his shoulder here, that's the clavodeltoid. Okay. Now we have acromios, right? The acromios right here. This one that forms his plates on the back of his shoulder. That's the acromiotrapezius. And then you can see this little guy forms a little bulge right here, sort of under the clavodeltoid. This is the acromiodeltoid. And these guys are all sort of lined up, these 3 when we talk about them. Okay? So, clavotrapezius, clavodeltoid, acromiotrapezius, acromiodeltoid. And then you have the spinos. So this, you see this big muscle right here? It's kind of triangle shaped. That one's the spinotrapezius. And then here, this one that's kind of coming toward his armpit, that's his spinodeltoid. Okay? So I'm going to count down through them one more way. Okay? So clavotrapezius, acromiotrapezius, spinotrapezius. Clavodeltoid, acromiodeltoid, spinodeltoid. Okay, not too bad. Now, kind of wrapping around from his side to his back makes kind of like these little bat wings here. This is the latissimus dorsi, and think of like latissimus like lateral and dorsi like your dorsal side, your back. So it goes from latissimus dorsi from his side to his back. Okay. So I'm going to flip around to his front, and we'll go through the muscles on his front. So the cats have muscles that we don't, obviously. One of the big, kind of easy, obvious ones is coming across the front of his chest here like a sash. I've kind of started to separate it out here. This is the pecto-antebrachialis. And think of like pecto, like chest, and then anti, kind of like against or across, brachialis, so it goes from across his chest to his arms. So brachialis, arm. So pecto-brachialis from his chest to his arms. Okay. And this is, it kind of like I said, it sort of sits like a sash across his chest. And cats use this to pounce. Like we don't have this. We don't pounce, right? Now lower here, these guys right here, this is pectoralis major. And then lower, you can see making this V right here, this is pectoralis minor. And then even lower, you can see another V. This is that one I talked about last week when I was talking about origin and insertion. This one is the xiphi humoralis, and it attaches to the xiphoid process or xiphoid process on the sternum, and it eventually runs all the way up to his humerus. Okay, so one more time, pecto-antebrachialis, pectoralis major, pectoralis minor, xiphi humoralis. Okay. Now when we get to his abdomen, you can see this muscle group right here with the shiny white covering. This is the rectus abdominis. And that shiny white covering has a special name. What it is it's a sheath-like tendon that keeps functional groups of muscles sort of together that can work as one. And that sheath-like tendon that makes it white is called aponeurosis. Okay. So you don't go to the gym and work out your ab, right? You work out your abs. What makes your abs and not your ab is this aponeurosis that's covering it. Okay. Now on the sides here, this darker red stuff, these are the external obliques. Now we have one other muscle group we talk about that has that aponeurosis on it, and it's in the leg, and we'll get to it in a second, okay? But right now, we're going to look here on this leg first. So the difference between the right leg and the left leg here, you can see they definitely look different, right? What happens is here we've got the top layer of muscle intact, the more superficial layer of muscle, and you can see this top band right here you can kind of separate them out with this line. Okay, this is the gracilis. I'm sorry, this is sartorius is the top one, and the gracilis is the lower one. And I always remember the gracilis is the lower one because it runs close to his groin, so gracilis groin. Okay. Now, what I've done here is I've cut away the muscle, like I kind of pinched it, kind of like you pinch the skin, I cut it. I pulled away this top layer muscle, so that right there would be the sartorius, and this would be the gracilis, or looking at what's underneath. And once again, you can kind of separate it out with this line with the vessels running through it. Yeah, it's always hard to keep it on the tray. Okay. Yeah. This lab is disgusting as this, but thank you for your efforts. Okay, so above the line you have 3 muscles, below the line you have 3 muscles, okay? And of the 3 above the line, 2 out of the 3 start with vastus, okay? You have vastus lateralis, which is the most lateral of the 3. You can see it on the very top of the leg here. And then vastus medialis, which is the most medial of the 3. And sandwiched in between, what do you see, that shiny white stuff, right? What is that called again? Aponeurosis, right? It's a sheath-like tendon, right? And this is the rectus femoris. So you may see a trend here. The 2 muscles we have that are covered with aponeurosis both start with the rectus.
Do they have a sciatic nerve?
They do, but we can't. It's deeper. We can't show it here. Okay. So if you remember, oh, I see it has aponeurosis on it. I'm pretty sure that it's going to start with rectus. Okay. But don't tell me if I ask you what's that sheath-like tendon. What is that stuff called? Don't tell me it's called rectus. So it's called aponeurosis, right? But it's just a hint. It may start with rectus when you're actually naming the specific muscle. Okay. So with the line right here, below that line, you have 3 muscles, right? And hint here, 2 out of the 3 start with the name adductor, okay? So this long, skinny one you see right here is most toward the inside. This is the adductor longus. So I remember adductor longus because it's the long, skinny one. This one right next to it, this guy right here, is the adductor femoris. And then this big one that kind of looks like a chunk of white meat from like a chicken thigh. This right here is the semimembranosus. Okay? And that's it. And I'll start passing out your tests.